In today's video, I'm doing something a little different. I am taking you through one of the workshops inside the Endo Collective membership. The theme of this workshop is Endo Belly Bloat Solutions. I walk you through some possible root causes for endo belly bloat, some little tests that you can do at home to gauge what the root of the problem may be for you. I also walk you through a few what I call gut health types, which are constellations of symptoms that point towards a unique root cause. At the very end of the workshop, I dive into solutions for each of these unique issues. I hope you enjoy this glimpse inside the Endo Collective inclusions. If you want to learn more, I'll drop the link to the Endo Collective in the show notes below, and I hope you enjoy. Alrighty, welcome to workshop number 4 in the Endo Collective membership. I do want to give you a bit of a warning before I jump into the material of workshop number 4, in that this workshop is going to be quite a bit lengthier than some of the workshops that you may have watched to date. And that is just simply because endo bloat solutions, this is a big topic. On this note, I have an entire course on digestive health, root cause issues, and solutions. So I really had to make the material in this workshop concise. So I have highlighted what I think are the most common causes and contributors to bloat with endometriosis. So I'm going to take you through some foundational digestive health habits that we just simply cannot neglect if we want to resolve endo bloat. And then we're also going to talk about some root causes for bloating with endo. And then lastly, we'll dig into the solutions. So if you do have any interest in deep diving the gut piece further, this workshop is going to be very comprehensive, but if for some reason you want to dive into a slightly more comprehensive resource, I will link to Endo Belly to Bombshell, which is my digestive specific course below. But with that being said, let's jump into our workshop. Okay. So, quick agenda here. We're going to talk just very, very briefly about why gut health matters. We're also going to touch on those digestive health foundations, as I alluded to in the beginning. I'm going to highlight the main causes of bloating. And I've highlighted main here because as much as I'd like to make this very, 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 very comprehensive, we'd be here for hours and hours and hours. So I've done my best to highlight the biggest contributors to bloating, and hopefully you can find some relatable material here and some actionable tips to help you resolve the bloat. And then of course we're going to discuss solutions because we want to make these workshops actionable. Okay, so you know me, I like to understand why I'm doing something. I like to understand the why. I like to understand the connections. So when it comes to gut health, why do we even care to address it? Well, firstly, there is this class of bacteria in the large intestine microbiome and the name of this class is Firmicutes or Firmicutes, that can extract more energy and nutrition from the foods that we consume. And so if we have an overgrowth or an overabundance of these bacteria, this class of bacteria, it can contribute to weight loss resistance or difficulties in maintaining weight. When it comes to metabolic activity, we have certain things that can reside within the gut microbiome that can control cravings. So for example, if you have an overgrowth of a certain type of bacteria or an overgrowth of something like yeast, for example, it can actually make you crave foods that will help grow that yeast or that bacteria that's like ultimately influencing those food choices. So that's one thing to consider. Also, when we're thinking about metabolic activity, we're thinking about how the bacteria within the gut can help with synthesizing certain vitamins. So specifically, we synthesize vitamin K and B vitamins in the gut, so specifically the bacteria. And then also to add to that, as humans, we don't have the capacity to break down fibers, and so we rely on the bacteria in our gut to do that for us. And so they're breaking those fibers down and they're helping to produce the beneficial byproducts of that fermentation. So a lot of this has to do with that metabolic activity piece. And also a lot of the more pro-inflammatory species in the gut microbiome can influence the way that we feel. So some of them produce toxins that can leave us feeling very unwell, very sickly. And so if we have an overabundance of those, that can also manifest in, day-to-day how we're feeling. So that's a really important consideration too. In terms of hormonal imbalance, all of our hormone is excreted through stool, particularly estrogen, testosterone as well. And there are certain bacteria in the gut that make up something called the estrobolome. And these bacteria can make something called beta-glucuronidase, which results in the cycling of estrogen back into the body. So this could be, a big source of estrogen dominance for some people who maybe have chronic constipation or issues with eliminating through the bowel. That beta-glucuronidase can also prevent bile acid excretion, testosterone, pharmaceuticals from exiting the body. So there are way more implications than just estrogen cycling back into the body when it comes to the hormonal balance piece. Immunoregulation via the GALT. So GALT stands for gut-associated lymphoid tissue. And this is basically the system by which the immune system communicates with the nervous system. And because the gut is our largest immune organ, it has a big role to play in that communication, right? And so if the gut is inflamed, this can affect the way that the immune system functions. This can affect the way that the nervous system responds as well. Barrier maintenance has to do with the integrity of the gut barrier. So we want an integral, healthy gut because we want to protect what's on the inside of the gut from what's on the outside, which is our bloodstream. If we do not have a healthy barrier, gut barrier specifically, we can have larger proteins, undigested proteins, larger molecules, toxins moving from the gut into the bloodstream, which we want to avoid because that type of a movement of toxins, larger proteins, undigested proteins into the bloodstream has some pretty significant implications. For example, increased autoimmune disease risk, swelling, water retention, food allergies, food sensitivities developing. And then anxiety and depression, I previously alluded to this a little bit. We make a lot of our neurotransmitters in the gut. So specifically things like serotonin, about 90% of our serotonin is made in the gut. And these neurotransmitters control mood, energy, sleep quality. And so the gut has a lot to do with just those general feelings of happiness, of mood, our ability to fall and stay asleep. So all really, really important reasons why we should consider optimizing gut health if there is room for optimizing the gut health. Okay, so to start us off, we really need to set the foundation. And just like you wouldn't build a beautiful, expensive home on a rocky foundation, you also wouldn't want to be spending money on resources, on testing, on supplements, if the foundation is not in place and is not solid and consistent for the most part. So there are 4 big things that we think of that make up digestive health foundations. One of those things is meal structure. So when I say meal structure, I'm referring to combining protein, fats, and fibers with every meal. Proteins are a lot of our animal products, so our meats, our seafood and shellfish, our poultry, our dairy products as well, eggs. We also get protein from things like legumes, lentils, chickpeas, beans. We get them from things like tofu, edamame, and then we get smaller amounts of protein through some grains and nuts and seeds and nut butters. Fats we find in things like oily fish, in nut butters, nuts and seeds, olive oil, olives, coconut, dark chocolate, cacao powder. And then our fibers is anything that comes from plant. So it's basically a collection of foods that include our non-starchy and starchy vegetables, our fruits, our legumes and lentils, our grains, our resistant starches, which are your cooked and cooled rice, pasta, potatoes, lupin, green bananas, things like this. So we want that combination at the meal. And the reason is 2 main things. One, this combination of foods really helps with blood sugar balance. So in order for the blood sugars to be nice and stable from meal to meal, we want to be pairing the protein, fat, and fiber. If you have just an apple, for example, as a standalone snack, that sugar from the apple is going to enter the bloodstream quite a bit faster than if you paired the apple with something like a turkey stick or a beef stick. And then if you tack on the fat to that, it will help with the blood sugar effects even more. And we really want the blood sugars to be nicely stable and balanced from meal to meal. The second reason that this is a digestive health foundation is because of complementary nutrition. So as people with endometriosis, we really want to be maximizing nutrient density of the diet. And one of the very helpful ways that we can do this is by pairing foods that have complementary nutrition. So an example of this would be pairing a steak with something like broccoli, because steak has iron and broccoli is a good source of vitamin C. And we know that vitamin C helps with complementing iron absorption. There's quite a few more examples of this in the corresponding resource, so I'll defer you to the resource for more examples of this. And then just to very quickly go back to the blood sugar balance comment, is the other thing here when it comes to, thinking outside the box, thinking kind of broadly, the importance of this for digestive health foundations. You will shortly learn that stress is a huge, huge reason for digestive dysfunction. And one of the biggest physiological drivers of stress is blood sugar dysregulation. Now, the second digestive health foundation is meal spacing. So very simply, we want to space the meals 3.5 to 4 hours apart. We want to do this because we have something called the migrating motor complex, which is this peristaltic sweeping wave through the stomach and bowels. It's activated after 90 minutes of fasting, but it stops for 3 hours after we have a larger meal. So really that 3.5 to 4 hour mark is the sweet spot. This is really the most perfect timing in between meals to help support that migrating motor complex. This is a really important digestive health foundation to perfect if you are somebody with chronic constipation, or if you are somebody who has a really slow transit time, which you'll learn about shortly. So that's it, very simply 3.5 to 4 hours. And then just to tack on to the last thing I said, if you are somebody who's struggling with a lot of chronic constipation or very, very slow transit time, which you will learn about shortly, another little addition here to the meal spacing that I'll add is a very effective strategy for helping to support bowel elimination or elimination through the bowels is spacing your last meal of the day 14 to 16 hours from the first meal of the day the next morning. That's a really effective strategy for helping to eliminate more fully, more completely. So that's another little nugget of information I would tack on to that one. The third digestive health foundation is eating seated. So food moves through us about 20 to 30% faster if we're eating standing. And really when you think about when you might be eating standing, chances are you're probably on the go, right? You're probably rushing out the door, you have somewhere to be, and this type of an environment is not conducive to good digestive health, right? It's kind of sending the wrong signals. If you can't focus on your meal, if you can't be present at the meal, then that might not be sending the right signals to your body, right? In terms of like, are we stressed? Are we on the move? Or are we really focusing on this meal and focusing on prioritizing absorbing the beautiful nutrition in this meal? And then of course you don't want food moving through faster because you want to give your digestive tract enough time to extract, all of the energy, all of the nutrition from the food that you're consuming. And then the fourth and final digestive health foundation is chewing well. So preferably 20 to 30 times a mouthful. And the reason that this is a digestive health foundation is because if that part of the digestive tract, i.e. your teeth, your mouth, is not doing its job, right, which is mastication, it's one of its jobs, but it's its primary job, mastication, breaking down the food, then some other part of the digestive tract has to compensate for that, right? So if you're kind of wolfing down food, like larger pieces of food are making their way down your esophagus into your stomach, somewhere along the line, you are putting a little bit of an added stressor on some other part of your digestive tract. So just like if you were working on a team with some colleagues at work and, all of a sudden, 2 other people's workload was delegated to you, and now you are drowning because you have your workload, and then on top of that you have your colleague's workload, and then your other colleague's workload. Now you're working 16-hour days, you're not sleeping well, you're not feeding yourself well. I don't know about you, but I would be very irritable. I would be very frustrated. I would be making mistakes. I'd be reacting at people that maybe don't deserve my hostility or my attitude, right? And so same thing happens with your digestive tract. If some other part is constantly forced to compensate, then it starts to get irritated. It starts to get reactive. And so we really want to make sure that we're doing
everything we can in every part of the digestive tract to support optimal digestion, and that can start certainly with the mouth and masticating really, really well. Okay, so again, back to the comment about me really liking to understand what's going on. There are so many possible causes for bloating with endometriosis, and we're definitely going to touch on quite a few of them in this workshop. But we can also start off with a couple of nice tests. They're not necessarily clinically accurate by any means, but they are good enough for the purposes of trying to figure out what they may uncover. So we're going to talk about a few tests and then a couple of checklists to determine if stress, inflammation, or deficiencies can be part of the reason why you're experiencing bloating. So the first test I want to talk about, and this test might not be new to many of you watching this workshop, but it's the transit time test. So with the transit time test, you pick one of the 4 options here on the screen. So 3/4 of a cup of corn, 3/4 of a cup of beets, 8 charcoal caps, not necessarily in 8 ounces of water, but you'll want to take it down with a cup of water, and then 2 tablespoons of sesame seeds. So these are your 4 options. You want to take them down roughly around the time of day that you're routinely producing a bowel movement. So if you're producing a bowel movement most often in the morning, then this is when you would want to try and integrate one of these things into your breakfast meal, with the exception of the charcoal caps. Those you'll want to consume either an hour before or an hour after the meal. And then you're looking for the first and last time one of these things shows up in the stool. So they'll each present a little bit differently. The corn will show up undigested, so you should be seeing kind of yellow specks in the stool. Beets will give the stool sort of a red tinge, almost like there's blood in the stool. The charcoal caps will turn the stools black, and the sesame seeds will show up with like a polka dot-like appearance in the stool, so you should be seeing like little white specks. Just as a side note, you do want to pick corn and beets in as whole of a form as possible. So I wouldn't be doing like shredded beets in like vinegar marinade. Like, you'll want them to be as fresh and whole as possible. Don't do like creamed corn, do whole corn if you can, fresh preferably, because some of the more processed versions take a little bit of, they just don't show up in the stool as well as some of these kind of fresher versions. So like I said, you're looking for the first and last time it shows up in the stool. So if you see it within 24 hours, I do want you to get excited, but also don't until you never see it again, right? So preferably we're not seeing it again 48 hours. We're not seeing it again, 72 hours, 4 days, 5 days, 6 days later. But you'll want to make sure you're checking the stool so that you're no longer seeing any. And so from the moment you take it down to the last time you see it in the stool, that would be your transit time. And we want to see that roughly at around 48 hours, no more than that. Test number 2 is the stomach acid test. So the baking soda stomach acid test. This test can help you gauge whether you are producing enough stomach acid. With chronic inflammation does pull resources away from digestion. So one of the things that suffers very, very often in people in the chronic illness population is stomach acid production. So with this test, you complete it by mixing 1/4 teaspoon of baking soda into 1/2 cup of water. You take that down on an empty stomach, preferably first thing in the morning, and then you set a timer. And if you produce a burp within 3 minutes, that's a really good sign. If it goes beyond 3 minutes before you produce a burp, then that is not the best sign. So I do typically have people do this test at least twice. And if you're getting a similar result each time, then you probably wouldn't need to do it a 3rd time. But if you're getting wildly different results, so one day you burp at 2 minutes and then the next day you burp at 10 minutes, I would suggest doing it a 3rd time and then averaging out the results. I'm not going to go through the betting HCl challenge here, but this is another way to assess stomach acid. So you basically titrate up 500 to 600 milligram capsules of betting HCl, which is a stomach acid replacement. And it basically involves you waiting on a burning or warming sensation in the stomach. There are directions in the corresponding resource on how to do this challenge, but just approach with caution. You really don't want to be triggering that burning, warming sensation. So definitely encourage you to be very, very careful, approach with caution. Definitely seek me out if you need some guidance there. But that is another way to assess stomach acid production. Okay, test number 3 is the 4-4-4 sugar challenge, which grosses me out a little bit, even just talking about it, because I'm not a big sugar fan. But This test can gauge whether there is some sucrose intolerance. So 3 quick steps here. Step 1, mix 4 tablespoons of table sugar into half a cup of water. Drink that down on an empty stomach. And then step number 3 is to assess for bloating, gas, diarrhea, or cramping over the next 4 to 8 hours. So yes, just keep your eyes peeled for those symptoms. Directions for the 444 sugar challenge will also be included in the corresponding resource as well. Okay, now we move on to physical symptoms of stress. So like I mentioned before, stress is one of the leading drivers of digestive symptoms and bloating. And that just makes a lot of sense, right? Because when your body is stressed, when the signal that your nervous system is getting is that, you are being threatened, your life is being threatened, your body can't tell the difference, your nervous system can't tell the difference between a work-related stressor or a personal life-related stressor that's stressing you out, and, for example, something like you being chased by a lion. All it knows is that that's the signal it's getting, and it needs to keep you alive. And so it taps into a bunch of different systems beneath the surface that essentially will pull resources away from non-essential systems like digestion and procreation and hormone production. And so it makes a lot of sense that you would experience bloating and slowed digestion and heartburn and reflux and all these other symptoms because your body's pulling resources from those systems to protect you and keep you alive. So some physical symptoms of stress to keep your eyes peeled for include chest pain, heart racing, palpitations, dizziness, shaking, muscle tension or jaw clenching, low libido, of course, any digestive symptom, bloating, diarrhea, constipation, high blood pressure, weakened immune system, so getting sick often, anxiety, irritability, panic attacks, stress rashes, and trouble sleeping. Now, there are a couple of ways that you can gauge whether you may be in that chronic fight or flight sympathetic nervous system state. One is through looking at your basal body temperatures. So you should be seeing a baseline basal body temperature of no less than 97.5 Fahrenheit or 36.6 Celsius. So no matter what part of your cycle you're in, your baseline body temperature should always be at least at this number. If they're falling below this number, that is not a good sign. That could be an indication that this could be an indication that your metabolism is not working very well, because a byproduct of metabolism is heat, right? And so you should be seeing that adequate rise, or not even a rise, but an adequate stable temperature at rest. And then if you are a cycling woman and you are not taking any kind of hormone therapies that might affect progesterone production, you should be seeing a rise of 0.3 to 0.6 Celsius or 0.5 to 1 Fahrenheit in your luteal phase. And because progesterone is what's responsible for this rise, your body really will not want to push resources towards progesterone because that's your progestation hormone. So your progesterone production would likely suffer if you were under stress, right, in a stressful season. And so you likely wouldn't see a rise of 0.3 to 0.6 or 0.5 to 1 Fahrenheit. Another biomarker to look at is heart rate variability. So these are some of the ranges that you're looking for depending on your kind of age range. 55 to 80 in your 20s, 45 to 75 in your 30s, 35 to 60 in your 40s. And the higher, so if you're an endurance athlete or you do a lot of cardiovascular type exercises, you would expect yourself to be higher on this range. But we certainly wouldn't want the numbers to fall below this. That is a really good indication that you are in sympathetic dominance, right? That fight or flight state of the nervous system. And then in terms of what is heart rate variability, it's the change in your heart rate between beats. A low heart rate indicates sympathetic dominance. As your heart beats faster in response to stress, the time between beats becomes shorter. So really good biomarker to look at. Now for this, I guess for heart rate variability as well, but also for deep sleep, these are biomarkers that you would need some kind of like smartwatch or Oura Ring or something like that to be, giving you this data. But deep sleep is another one that you can look at. So deep sleep can both be affected by stress. It can also cause stress, right, if you're not sleeping really well. So you would expect 10 to 25% of your time sleeping to be in deep sleep. And that is something that you can capture on these smart devices. So that's roughly about an hour and a half to 2 hours of your sleep in deep sleep. Cervical mucus, there's a couple of signs you can look out for too. So long stretches, so over 6 days of slippery, stretchy, clear cervical mucus, so kind of that egg white discharge that stretches over 2 inches. It's clear and it's lubricative, so you get that kind of slippery sensation. And then double peaks could also be an indication of stress, because typically what a double peak could indicate is your body's kind of gearing up to ovulate, right? So you start producing that peak type cervical mucus, which, you know, traditionally we're only making in our fertile phase. But then it goes, you know what? No, this is not the time. The body's not feeling it. We're under stress. This is not the best environment for procreation. So it stops that, and then it tries to ovulate again a second time. And so if you're seeing those double peaks, or at the very least the cervical mucus pattern that's consistent with those double peaks, then that could be an indication also of stress as well. Okay. Inflammation. I very often say inflammation precedes food sensitivities, and I'll dig into that a little bit more. But kind of like putting salt on a wound or like vinegar on a wound, right? Like the wound is there, you're adding something to it, you're going to get a reaction, right? So similarly, if the gut is really inflamed and you're putting food in that maybe doesn't sit well or is a little bit more processed, or, you know, traditionally kind of one of those foods that we know to be a gut irritant, like processed carbohydrates or high sugar foods or alcohol, then you're going to get a reaction, right? And that doesn't necessarily mean that you're reactive or sensitive to the food that you're consuming. It's a sign that there's just a lot of underlying inflammation. So some symptoms of GI-related inflammation are food sensitivities or reactions, sticky or hard to wipe clean stools. When the gut lining is irritated, it secretes a mucus because it's a mucous membrane. That mucus mixes with the stools, and then it comes out this sticky, hard to wipe clean stool. So if you're seeing this symptom, it's a really good sign that there's inflammation there. Abdominal cramping, pain. Pain is a characteristic sign of inflammation. Urgency, diarrhea. Typically when you're vomiting, when you're having diarrhea, watery stools, this is typically a sign that the body's trying to get something out, right? Something that it doesn't particularly like or want in the body. So yeah, that typically would be something that's generating a bit of inflammation. Less bloating with lower fiber foods. So particularly in the case of something like small intestinal bacterial overgrowth, which can be inflammatory, it does tend to cause FODMAP sensitivities or fiber sensitivity. So if you're finding that you're not as reactive with lower fiber foods, you do better with maybe slightly more processed foods and things like this, then that could be an indication that there is some underlying issue, you know, something like SIBO, for example, or large intestinal bacterial overgrowth, which we'll talk about in a little bit more detail in a moment. Joint pain, swelling. You may or may not have heard me say before, the solution to pollution is dilution. So if something is entering the bloodstream that the body, you know, doesn't want to see there, it will try and dilute it. So often you'll get water retention, swelling. Joint pain is often how body-wide inflammation manifests. Mucus in the stool we spoke about. Constipation creates a pro-inflammatory environment in the gut. And then one round of a broad spectrum antibiotic will wipe away about 30%, 20-30% of the microbiome, especially if it's a, broad spectrum kind of strong antibiotic. And so naturally, if you're wiping away this anti-inflammatory bacteria, which unfortunately also happens to be, less antibiotic resistant, then by default, you're creating more inflammation there because the anti-inflammatory bacteria are anti-inflammatory. Okay, and then some symptoms of body-wide inflammation include stiff joints, body aches, allergies, food sensitivities, swelling. Explained that one already. Also, when it comes to the food sensitivities, so if you do have increased gut permeability, or what some people call leaky gut, it means that the gaps between the cells that line the gut are bigger. They're bigger than they should be. And because they're bigger, there's more room for undigested proteins, larger molecules, toxins to move through the gut into the bloodstream. If this is happening enough and you're routinely consuming something like, let's say, tomato, then these partially digested proteins, which should be fully digested at this point, are moving into the bloodstream from the gut. They're not supposed to be there, right? They're supposed to be fully digested at this point. Your immune system goes, why the heck are you in the bloodstream? It mounts an immune reaction to that, and now every single time you're eating a tomato, you're getting a reaction. And it's not because you've suddenly become reactive to tomatoes, it's because there's some kind of underlying inflammation or leaky gut or some kind of an imbalance there that's driving that reactivity. Liver pain on the right side, pain between the shoulder blades, upper right quadrant pain. These are all symptoms that can be consistent with something going on either with the liver or bile flow or gallbladder function. Bloating upon waking or unrelated to food. This could be more visceral hypersensitivity or central sensitization, so this abnormal sensitivity of the internal organs. So that's typically more a sign of like body-wide inflammation, a lot of nervous system involvement in your inflammation. Skin reactions, rashes. So inflammation very often presents with, things on the skin, rashes, hives, things like that. Chronic fatigue, low mood, frequent infections, changes in weight, especially weight loss resistance or big jumps in weight, right? Because, and it's not that I'm condoning necessarily checking your weight every day. I'm not a big fan of that, right? It's not a realistic timeline for expecting changes in your weight. But if it is something that you do and you're seeing a jump of 3 or more pounds overnight, that is not a realistic reflection of a true fat gain. Because in order to put on 1 additional pound overnight, you would need to be eating in excess of 3,000 calories. And I would think for most people that's highly unlikely. And so the only other realistic explanation would be inflammation or water retention. Okay, and then also we can have ileocecal valve inflammation. So if you find your belly button and then you locate the topmost part of your right hip bone and then draw a line in the middle, that is where you'll find your ileocecal valve, which connects your large bowel to your small bowel. And so if you're experiencing pain in the lower right quadrant, bloating, abdominal distension following meals, alternating between constipation and diarrhea, excessive gas production. One really telling sign that it could be your ileocecal valve is softer stools after a night of drinking, chocolate intake, coffee, or caffeinated beverages. These are all foods that can calm the ileocecal valve. And because it becomes kind of calm, relaxed, you tend to see looser stools result from consuming these things. Groin pain, right shoulder pain, ringing in the ears, nausea, dizziness, and a bad taste in the mouth can all be symptoms of ileocecal valve inflammation. Okay, next on the list of kind of root cause issues is cofactor deficiencies. So you've probably heard me say it 100 times before, but anything that your body needs to make, it needs tools to make, right? Just like if you were making a meal for your family or for yourself, you need certain ingredients, otherwise you're just not going to be able to make that meal. So almost every single vitamin and mineral is important for digestion, but these ones in particular are very important. Magnesium helps with reducing inflammation. It's needed to make stomach acid. It's also a really important mineral for supporting the nervous system. And remember to take you back to stress being a big leading cause of digestive symptoms. We want to make sure we have enough of these minerals to support nervous system improvements, nervous system balance. Zinc, essential for stomach acid production, also a very important mineral for supporting the thyroid. Thyroid controls not just metabolism, but also digestion, hormone production. And so 100% sluggish thyroid function can be a reason for bloat, chronic constipation, all sorts of other digestive symptoms. Iodine, needed for the thyroid. B vitamins, really important for nervous system function, as well as for converting food into energy for the body. Selenium, really important for the pancreas, for reducing inflammation. Pancreas makes our digestive enzymes. Protein is needed for making enzymes, including digestive enzymes. Sodium is an extremely important electrolyte for making stomach acid. And then potassium is a really important electrolyte for motility. So it really helps with movement of food waste bacteria through the digestive tract. Okay, so let's talk a little bit about some symptoms of deficiency of some of these minerals. I'm really going to try and plow through this. You can always circle back to these slides and kind of do a little audit for yourself of some of these symptoms. Of course, these symptoms are not exclusive to deficiencies of these various minerals. Some of them are a little bit more telling than others. I would say the one that's most telling for magnesium deficiency is muscle cramping at rest. So if you're kind of lounging in bed, you're stretching, and you get a muscle cramp, that is very consistent with magnesium deficiency. Also, muscle twitching, like in the eyelid or in some part of your face, that tends to be quite consistent with magnesium deficiency as well. Things like anxiety, things like a stressful season, perspirating a lot, these types of symptoms will potentially lead to magnesium deficiency because we do have heightened needs for magnesium in a season of stress or if we're losing magnesium through sweat. These numbers on the screen here, over 2 milligrams per deciliter and over 0.82 millimoles per liter, are the numbers that you want to see in the blood, so above these numbers, but keep in mind only 1% of our magnesium is found in the bloodstream. The remaining 99% is found in tissues and other organs of the body. Okay, mineral sources, so, feel free to circle back to these slides. There are also some sources listed out in the corresponding resource, but if you suspect that you may have magnesium deficiency, you want to try and support your levels with diet. These are some great sources to lean into. Okay, so for zinc deficiency, probably the most telling sign and symptom would be something like the white spots on the nails, but also any dry skin condition or issue could also be zinc deficiency related. So eczema, psoriasis, dandruff, hair loss as well, dermatitis. And then if you happen to have a T4 and a T3 lab, if your T4 is normal but your T3 is low, then that could be an indication that you're either zinc or selenium deficient or both, because those are two minerals that are very, very, very important for thyroid hormone conversion. And then in the blood, you want to see these numbers 90 to 130 or 11 to 19.89 umol per liter. And then we've got some sources here if you wanted to try and get your zinc intake up through diet. Iodine. So symptoms like hair thinning, swelling of the thyroid gland in the base of the neck, cold intolerance, slowed heart rate, irregular cycles, thinning of the eyebrow hair, the outermost part of the eyebrow hair, is possible sign of iodine deficiency. We want to see the number in this range, 40 to 92 microgram per liter. These are some iodine sources for you to consider. And then B vitamins, there's a few of them. So depending on the B vitamin, there are some symptoms that are more or less consistent with the deficiency. So thiamine, B1, short-term memory loss, confusion, muscle weakness, very common. You also want to consider whether there was a bariatric surgery, if there's a lot of alcohol use, a high liver burden. So if you're taking a lot of supplements or medications that might burden the liver, you definitely want to focus on the thiamine intake. For biotin, rashes, pink eye, hair loss, tingling are some symptoms you're looking for. For riboflavin, rashes, inflammation of the mouth or tongue. Probably the most telling symptom is the cracks on the side of the mouth here. And then special consideration for vegans and pregnant or breastfeeding women, because your needs increase there and the vegan diet isn't as rich in riboflavin. Folate, trouble concentrating, irritability, headaches, heart palpitations. If you have any malabsorption issues or suspect malabsorption issues like small intestinal bacterial overgrowth, or if you've got a fat malabsorption issue, if you smoke, if you're drinking alcohol, if you have increased metabolic needs because you've just had a surgery or childbirth, then folate is definitely a B vitamin that you're going to want to pay a little bit more attention to. Okay, niacin, skin symptoms, tends to present that way. B12, low energy, pale skin, heart palpitations, loss of appetite. Also a really important one to consider if you suspect absorption issues like SIBO, if you've had stomach surgery. A vegan diet is lower in B12, and then metformin will also deplete vitamin D, make it harder to absorb. Pantothenic acid deficiency can present with irritability, restlessness, fatigue, sleep issues, nausea, vomiting, cramping, numbness. And then B6, which is a really important B vitamin for supporting progesterone, can present in anemia, rash, seizures, depression, confusion. And if the diet is just very low nutritionally overall, that's really an important consideration for any vitamin and mineral, but for B6 as well. And B6, B12, and folate are the B vitamins that I would be looking at if you have a history with iron deficiency, because There are many types of iron deficiency. You can have a straight iron deficiency anemia, which is just, not getting in enough iron or not absorbing the iron. But you can also have cofactor deficiency driven anemias, like a pernicious anemia, which is a B12 deficiency driven anemia, B6 folate deficiency driven anemia, copper deficiency driven anemia. So those are just a couple of the B vitamins I would be looking at. These are, you've probably seen this table before at some point, but these are some good sources of most B vitamins. You can see that organ meats tend to top the list on a lot of these. Okay, selenium is a hard one to gauge through symptoms. The biggest one I would say is if you know definitively you have been exposed to heavy metals, because your body will use selenium to buffer the effects of heavy metals. So specifically things like mercury, arsenic, and lead. Those are some selenium sources. And then protein, very rare to have protein deficiency, but swelling, getting sick often, skin hair changes like hair loss, wounds that are slow to heal, any stomach acid issues, just because stomach acid begins the breakdown of protein. So you can measure total protein in the blood, and it can be low if the protein intake is low, but also the protein marker in the blood could be just a general marker of digestive dysfunction as well. So not always indicative of protein deficiency in the diet. Okay, sodium. I think sodium and potassium are underestimated for how involved they are in generating energy for the body. I don't know if you remember from like high school science, the sodium to potassium pump, but this is at the very, very core of how we generate energy for the body. Not we, I guess our cells generate energy for the body. So if you remember the sodium to potassium pump, every cell has one. Every cell in the body has one. And so that pump heavily relies on adequate sodium and potassium through the diet. So some symptoms of deficiency include exhaustion, fatigue, low stomach acid, low blood pressure, headaches, poor protein digestion, because sodium is really important for making stomach acid, bloating, allergies, dizziness. And you can measure sodium in the blood, but this is more of a marker, I would say, of adrenal gland function than it is of sodium adequacy. Some sodium sources. And then potassium, probably the most telling symptom for potassium deficiency would be cramping during physical activity. So that's how you tease apart potassium deficiency from magnesium deficiency. And then water retention, because it is a natural diuretic, constipation, heart palpitations. Those are some other signs of deficiency. And then you can measure potassium in the blood as well. Electrolytes are very tightly regulated in the body, so not always the best marker of deficiency, but it can be measured. Okay, so we've talked about like the root of the root causes. Okay, so we've talked about the digestive health foundations. We cannot bypass those. I would highly encourage you not to invest money or resources or time in any of the things that we're going to talk about next until you can confidently say, I'm crushing those digestive health foundations. Remember, these are foundations on which you build. Even if you do feel really confident about pursuing some of the treatments that we're going to talk about in this workshop, I would still encourage you to focus on those foundations if you feel like there's room to improve those, because they're so important, and you might be throwing so much energy and effort into resolving these issues when you could resolve them so much faster and so much more efficiently if the foundations were in place. So let's now go into talking about some additional root cause contributors to bloating. So root cause number one, constipation. So you can see I've got this sort of broad statement along the top. You must focus on those digestive health foundations. Assess your transit time, assess the stomach acid, gauge whether there can be deficiencies. This is all really important for you to understand before even, starting your investigation of some of these root cause issues. Constipation is defined. So as I'm going through these root causes with you, I am going to give you some concrete things that you can do to determine if that might be an issue for you, where I can. So some things, they require more advanced testing, things like this, but where I can give you sort of a concrete definition or tell you, this is how you can figure out if you have constipation, I will do that. By the way, the transit time test that we spoke about earlier in the workshop is one way that you can gauge if you have constipation. So a transit time over 48 hours is, consistent with constipation. Constipation is defined as fewer than 3 bowel movements a week, stools that are hard, dry, or lumpy, stools that are difficult or painful to pass, and a feeling that not all stools have passed. So even if you're having 3 bowel movements a day, if not a single one of those is feeling complete, that could be constipation. You could also be having a bowel movement every day, but if they're hard, dry, painful to pass, that would be hitting the criteria for constipation. The second root potential cause for bloating is LIBO, which stands for large intestinal bacterial overgrowth. Some symptoms, and you will learn shortly that there are many different types of large intestinal bacterial overgrowth. You can have a large intestinal bacterial overgrowth that's driven by overgrowth of pro-inflammatory bacteria. You can also have a type that is driven more by a lack of the beneficial anti-inflammatory bacteria that should reside in the gut. So there are a few different kinds. Bloating that intensifies 2 to 4 hours after a meal could be a sign. If antibiotic use corresponds with the start of symptoms, so if you've taken an antibiotic, it's wiped away some of that beneficial flora, and then you think back and you go, yeah, actually, I think my symptoms do correspond with when I started an antibiotic. You get stomach aches, symptoms improve with probiotics. So just like if you were working on a team, you had a project that required 4 people, but there's 2 of you working on the team. If you had 2 other people join the team, you'd probably work more efficiently. You'd get things done faster. It would get done better with better quality. So same sort of thing. If there isn't enough of the beneficial bacteria in your gut to handle the final stages of digestion, if you add more of these active bacterial cultures into your gut to help with that, you can often see some symptom improvements, right, or symptom resolution. If you experience heartburn or reflux, I very often see low bacterial diversity in the gut manifest in upper GI symptoms like bloating or heartburn or abnormal burping or belching. If alcohol or processed foods intensify the bloating, there is an inflammatory type of LIBO. And so naturally, if there's already this kind of baseline underlying level of inflammation and you're adding these kind of characteristically pro-inflammatory foods into the body, then you're going to get a bit of a reaction there. And then, of course, there are certain tests that you can do to determine if there's LIBO, right? You could do a functional stool test that will break down your bacterial diversity. So that is one way that you can determine just kind of right off the gate. But if you can't or don't want to do some functional stool testing, then you can go based off symptoms. This checklist you'll find in the corresponding resource for the module, because like I mentioned before, there are a few different types of LIBO. And so this, in addition to a checklist that I will talk with you about a little bit in a moment, can kind of help you tease apart, is it maybe more of a LIBO of overabundance of the pro-inflammatory strains, or could it be a LIBO of underabundance where you just don't have enough of the good guys that you need? Okay. Next possible root cause is food sensitivities. But like I alluded to previously, this can be tricky to tease apart if there's underlying inflammation. So if you're getting any of those physical signs of inflammation, like the sticky stools, the pain, the urgency, I would definitely encourage you not to stop there, not to just stop at this food is causing these symptoms, but to deep dive, like what else could be going on beneath the surface. There are a couple of ways that you can gauge whether food sensitivities are the problem. So there are IgA wheat or gluten sensitivity panels. You can do a blood celiac disease test. You could do a food marble FODMAP challenge. So food marble is a little handheld device that you can purchase and you blow into it, and you can do 4 or 5 different FODMAP challenges to gauge if you may be sensitive to a specific FODMAP category. There's lactose intolerance tests. There's skin prick tests for food allergies. There are various stool tests. So the stool test that I routinely use in practice does check for immune reactivity to gluten in the gut. It does check for fat malabsorption as well, which it can manifest as food sensitivities. Another way to gauge would be, removal. That would be another strategy, right? Remove the thing that you're suspicious that you're having a reaction to. If the symptoms improve, then fantastic. You can also complement your body's breakdown of that problematic food. So, an example of this might be a lactase enzyme. If you're sensitive to lactose, it might be Beano if you're not making enough of the alpha-galactosidase enzyme in beans. It could be something like FODzyme if you're sensitive to a few specific FODMAPs like fructan, for example, found in garlic, onion. And then biphasic treatment. So this is a treatment diet that I use when there's a lot of inflammation presenting, and we want to control those symptoms by consuming just lower fermentable foods, right? So if the gut is getting irritated because you're consuming a lot of highly fermentable foods, we can calm that reaction by putting in the lower fermentable foods. And then you can do that over a short window of time. You can do it over a long window of time, really just depending on how severe the symptoms are. But these are a couple of ways that you could either kind of navigate the food sensitivities or gauge if it's something concrete like celiac or gluten sensitivity or a FODMAP sensitivity. Root cause number 4 is SIBO, which stands for small intestinal bacterial overgrowth. There are traditionally 3 kind of symptoms that I see almost always correspond with a positive SIBO breath test result. The first is chronic constipation or diarrhea. The second is that the symptoms started with a triggering event. So this could be childbirth, this could be food poisoning, this could be abdominal injury, surgery. Anything like this, these are risk factors for small intestinal bacterial overgrowth. And then the third thing that kind of lines up is painful or persistent bloating. So bloating that gets progressively worse throughout the day. It's painful, it's uncomfortable. That is another symptom that I find is consistent with a positive SIBO result. Okay, the best we have available to us right now, and it is certainly not without flaws, but it is the best we have right now for gauging if somebody can have SIBO. We want to mitigate the potential for false positives with doing a really accurate prep for the test, and you will find those directions in the corresponding resource if this is something that you suspect you have and you want to test. So there are 3 gases that you can measure on a SIBO test: hydrogen, methane, and hydrogen sulfide. There's only one lab that runs all 3 gases, and it's the Trio Smart. The one that I routinely run in practice is just the hydrogen methane SIBO breath test. There are also 2 substrates, lactulose and glucose. I personally like to use lactulose because it moves all the way through the digestive tract, whereas glucose is absorbed relatively high up. And so you might capture a positive kind of higher up in the small intestine, but typically the numbers will start to decrease as it approaches what I call the state of transition at the 120-minute mark, which is when the substrate moves from the small intestine into the large bowel. And I personally find the information that we get from having those numbers really, really helpful. So I like to use a lactulose solution for that reason. The diagnostic criteria for a methane dominant SIBO is a 12 parts per million rise from the lowest preceding value within the first 90 to 120 minutes. So methane is the CH4 here. And then the diagnostic criteria for hydrogen is a 20 parts per million rise from the lowest preceding value within the first 90 to 120 minutes. So in the example here circled on the screen, our lowest number is 6. So the diagnostic criteria would be 26 or above before the 120-minute mark, and we're seeing that at the 40-minute mark there with 50. So this would be positive for hydrogen. Now here's an example of a methane dominant SIBO result. So I'm looking at the one on the left. Remember, the diagnostic criteria is 12 parts per million. So our baseline number is the lowest number, which is 9. And so anything 21 and above would be considered positive. And we're seeing 21 at the 45-minute mark there. So that is positive for methane. Okay, and then this is an example of both a hydrogen and a methane positive SIBO result. So again, the diagnostic criteria for hydrogen is a 20 parts per million rise. So in this example, the baseline number is 14. So anything 34 or above would be considered positive. We're seeing that at the 60-minute mark. And then for the methane CH4 there, we're looking for that 12 parts per million rise. The lowest number is our baseline number, which is 16. So anything 28 or above would be considered positive. And we are seeing that at the 80-minute mark there at that 31. So the baseline number being above 5 is also very telling. So this is also something that I like to look for on a SIBO breath test. So there are a few reasons why you might have an elevated baseline over 5. One is poor test prep. So if you did in fact eat something that can ferment, and I won't go through the test prep in the video, but there is a very comprehensive resource for the test prep in the corresponding resource. It can tell us that, yeah, you did the test prep incorrectly, you were eating something fermentable, and so you're seeing these high numbers present on your test. It could also be an indication that somebody has really, really slow transit time, or alternatively large intestinal bacterial overgrowth, because this is telling us that there was fermentation happening before you even swallowed the substrate, the lactulose, or the glucose, depending on which one you're using. And so there's fermentation stemming from somewhere, right? And chances are it's stemming from the gut. You've probably got a large overgrowth there, and you've got a lot of bacteria munching away on fibers that you ate like 2 days prior, and you're seeing these large numbers. Okay, and then this is just a quick example of a negative SIBO breath test result, right? So we're not seeing that 20 parts per million rise. Anything over the 120-minute mark would be the large bowel, where we would expect those numbers to increase, and we're not seeing a 12 parts per million rise for methane either. Okay, root cause number 5 for bloating is pancreatic insufficiency, which is just when your pancreas isn't working well enough to produce an adequate amount of digestive enzymes. So, one way that you could just very easily gauge if this might be the reason for your bloating, there are some blood tests that test for amylase, which is the enzyme that breaks down carbohydrate, and then lipase, which is the enzyme that breaks down fats. So, these are the ranges. If I see that somebody's got an amylase of like 34 and a lipase of 17, I'm going to want to intervene on that, right? Like they're falling within the range, but they're very, very low. You can also look at the elastase marker on a GI map stool test. So we want to see that number over 500. And then steatocrit on a GI map will tell us if there's fat in the stool, right? And so obviously if fat is showing up in the stool in these abnormal quantities, then it probably means you're not breaking the fats down very well. So those are some tests, right, to gauge and determine concretely if pancreatic insufficiency may be a problem for you. These are some symptoms. So seeing undigested food in the stool. Remember, the number one cause of that is not masticating really well. So I definitely would spend some time doing that better and then seeing if that resolves the undigested food in the stool. Craving carbohydrates, sugar, or bread often, because it's the same organ that also releases insulin. So if the pancreas is being stimulated aggressively to release insulin, you might be experiencing this symptom as well, and that can sort of be an indirect indicator that it's not really working well to produce enzymes. Weight loss resistance, floating or greasy looking stools, and feeling full quickly after just a few small bites. All right, so we're about an hour in and we're getting to our solution.